How do abnormal cervical screening results differ from cancer? Imagine getting a test result that shows some cell changes in your cervix. It can be confusing to understand what that really means. Abnormal cervical screening results show that the cells in your cervix are not exactly normal, but they are not cancer. These results often come from tests like the Pap smear or the human papillomavirus test, which look at cells from your cervix under a microscope. When these cells look different from healthy cells, the result is called abnormal. But this does not mean you have cancer. It could mean you have mild cell changes, an infection, or precancerous conditions that might develop into cancer if not watched carefully. Most abnormal results are due to mild changes called low-grade dyskaryosis, or more serious but still non-cancerous changes called high-grade dyskaryosis. These changes are often caused by infections like human papillomavirus or inflammation. Sometimes, the abnormal cells go away on their own without treatment. Other times, they might need closer monitoring or further tests, such as a colposcopy or biopsy, to see if they are precancerous or not. The goal of screening is to find these cell changes early so they can be managed before they turn into cancer. Cancer, on the other hand, means that the abnormal cells have grown in an uncontrolled way and have invaded nearby tissues. Cancer cells have specific features under the microscope, such as rapid growth and the ability to spread beyond the original site. This invasive growth is what makes cancer dangerous and harder to treat. Unlike abnormal cells, cancer cells do not usually go away on their own, and requiring more extensive treatment, including surgery, radiation, or chemotherapy. The main difference lies in the cause and behavior of the cells. Abnormal cells are often caused by infections or inflammation and may not be cancer at all. They show changes but do not invade tissues or grow uncontrollably. Cancer cells are a result of malignant transformation, meaning they have acquired the ability to invade and spread. Not all abnormal cells will become cancer, but some can if left untreated, which is why follow-up is so important. When you get an abnormal result, your healthcare provider will usually recommend additional tests to clarify what's happening. These might include a colposcopy, where a special magnifying instrument is used to examine your cervix more closely, or a biopsy, where a small tissue sample is taken for analysis. These steps help determine whether the abnormal cells are precancerous or if they are benign. If cancer is suspected, more comprehensive treatment will be necessary, but this is usually confirmed through biopsy and pathology reports. Screening aims to catch these changes early, so you can take action before they develop into cancer. Remember, an abnormal result does not mean you have cancer. It is a warning sign that needs further investigation. Early detection and proper follow-up are key to preventing cervical cancer and maintaining reproductive health. Always consult your healthcare provider for personalized advice and management options based on your specific situation.